Hello, everyone, and welcome back to another episode of Acupuncture is My Life. Now, in this episode, I'd like to talk about lung cancer. And I've been asked over the recent months, what are the symptoms of lung cancer? And I decided, I'll just do a podcast discussing it because so many individuals globally listen to Acupuncture is My Life podcast. And hopefully it'll help them as well as the individuals that have asked me. But it's important that you're aware of symptoms of all types of cancer. But in this case, we're going to talk about lung cancer. And there's so much to learn about how you can benefit from acupuncture and various types of disorders on the Acupuncture is My Life YouTube channel. So if you are not following Acupuncture is My Life on YouTube or have subscribed to us, do so. Many great episodes discussing various disorders and how you could benefit from acupuncture as well on YouTube. Just go to Acupuncture is My Life. Okay? And we may even be doing a video soon on the symptoms of lung cancer and go more in depth. But, I'll scratch the surface in this episode. But don't forget to subscribe to our YouTube channel. But when it comes to lung cancer, understand something. It can produce very uncomfortable symptoms such as like a terrible cough that just gets worse and worse, chest pain, trouble breathing. And lung cancer usually happens when cancer cells tend to form in the lung tissue as well as the lining of our air passages. And you see, lung cancer is a very common cancer in the Western Hemisphere. And this pertains to both genders, men and women. Now, does it exist in the East? Yes, it does. But it's not as high up on the chart as far as being a common cancer as it is in the West. And there are two main types of lung cancer. Like one of them is small cell lung cancer, and the other one is non-small cell lung cancer. And you see, lung cancer is very hard to detect in its early stages. And understand something, its symptoms, it usually starts out mild and then it progresses slowly. And then if you develop symptoms, you may experience like chest pain, a nagging cough. And you'd also experience a lot of respiratory infections or frequent respiratory infections. All right, and you see to an acupuncturist, the undetectable aspect in my experience, and other acupuncturists have experienced different approaches or onset of symptoms, depending on the stage or time period when a patient may come in to their clinic. Like to mine is like this extreme qi deficiency, that's lung qi deficiency. When you have this incessant cough, trouble breathing, and it usually starts when the qi of the lung has been negatively affected. And these are like the early stages, and I've caught, certain patients in the early stage when I saw severe lung qi deficiency, sent them to get tested, and it was early stage, and it was they went into remission. I don't really want to get too deep into detail because it was a handful of patients, and they do listen to the Acupuncture is My Life podcast, and although some of them asked me to discuss it, I haven't gotten clearance from others, so I really don't want to delve too deep into my experiences with these patients, although I wouldn't mention their names. But it progresses from the chi stage to the point where it begins to affect the yin aspect of the lungs. And now you're delving between stage 2, stage 3, but then the yin aspect can be affected in stage 1. Okay, and that's the more substantive aspect of the lungs, which then begins to affect yang, which is more energetic. Because yang, when it comes to yin and yang, yin nourishes yang. And it's important that you understand that. So when yin is severely affected, it can easily impact the yang aspect of the lungs. But symptoms of early stage lung cancer can start out like mild and progress slowly, where again it can subtle chest pain, a nagging cough, and a lot of respiratory infections. But the important thing here is to understand the warning signs of lung cancer so you can get tested early enough. And this is why, again, I say over and over, it's important to see an acupuncturist for regular wellness visits. It's very important, along with seeing your primary care physician on an annual basis for your annual checkup. Because I have colleagues around the world who have caught it early, worked together with an oncologist, sent notes over to the primary care physician, and boom. It's super, super important. And I know it can be a scary situation when getting tested, but early diagnosis tends to improve the overall outcome of your treatment and even prolong your life. Now, in some of these early symptoms, right, in the early stages of lung cancer, it can mimic like other conditions, and you would have no clue that it's related or tied to lung cancer. And a lot of this has to do with there are very, very few, and I'll emphasize the word few, nerve endings that are in the lungs. And this is what plays into making it, the early stages or early symptoms, undetectable. And this is what plays into the tumors growing, and there's no pain or discomfort or any noticeable symptoms. But in the early stages, like if you develop symptoms, let's say a cough that's getting worse over time, chest pain, discomfort in the chest, wheezing, notice that your voice is changing and it's getting a little more hoarse, shortness of breath, along with frequent respiratory infections, see an acupuncturist and see your primary care physician. It's important that you do that. Because cancer is nothing to take lightly. Again, why? Because health is wealth. The wealth is not in the bank, the wealth isn't in the safe, nor is it on an app on your phone or in a cryptocurrency account. The wealth isn't under your mattress, it's not under the doghouse in the backyard, and the wealth is definitely not in the shoebox in the closet. Now I'll hear people say, oh, I got stacks in the shoebox in the closet. What's wrong with that? Really? How long is it going to last you? And when you're gone, what good is it to you? When it's gone, you can always make more. So understand that the wealth isn't in your wallet, it's not in your purse, nor in your pocket. It's in you. Now, there are progressive symptoms of lung cancer. As it grows and it spreads, it gets like really aggressive. You'll start to notice like repeated lung infections, like bronchitis and pneumonia. And these types of infections tend to be ongoing if you have a tumor in your lungs. Other progressive symptoms can include headaches, constant headaches or weakness, loss of appetite, difficulty breathing, trouble swallowing, coughing up blood, swelling in your face. What else? Well, lymph nodes, will be large. And I say this a lot, unintended weight loss, especially unintended weight loss. And I say that a lot, especially on the Acupuncture's My Life YouTube channel. And also, there'll be fatigue and feeling more tired than usual. Take a deep breath and you'll feel discomfort in your chest. Or when you're laughing hard, or not really even hard, but just laughing, there's pain in the chest. Or when you cough, there's pain. And you're coughing up a lot of blood. Now, once you see the blood, when you're coughing up a lot of blood, seek emergency care right away. And also, some lung cancers can also cause other syndromes that affect different parts of the body. And they tend to be reversed or resolved completely when lung cancer is being treated. But understand, let's say like progressive lung cancer can cause conditions such as Horner syndrome. And that's when the tumors in the upper part of the lungs, that's usually caused by the tumors in the upper part of the lungs, which will cause drooping of one eye. If you notice one eye is like droopy or drooping, and the pupil in that eye is smaller than the unaffected eye. And then when you sweat, you don't sweat on that particular side of the face. Horner syndrome tends to be more noted in non-small cell lung cancer. Now, another syndrome can be superior vena cava syndrome. In this instance, the tumors in a person's chest can put pressure on the superior vena cava, which is a large vein that carries like blood from your head and arms to your heart. And it'll cause like blood to back up in the veins, and then the signs of that would be like dizziness and headaches and swelling in the face and arms and neck and even the chest. Another syndrome that can be caused as a result of lung cancer can be paraneoplastic syndromes. And these are several syndromes that tend to occur in small cell lung cancer. For example, blood clots, nervous system problems, too much calcium in the blood, which is called hypercalcemia, and even Cushing syndrome. And Cushing syndrome is usually like a condition that happens when cancer cells make too much cortisol, which is a stress hormone. Okay. But, I'm just going to stick to the basics, when it comes to lung cancer. And like I said, I may do an episode on the Acupuncture's My Life YouTube channel. because this is really, I mean, being asked this question several times, you know, just sort of like rings bells to me to say, you know, do an episode on YouTube. But let's just close it out, let's say with end stage symptoms, you know, since I've gotten you this far. Because, you know, once lung cancer spreads to other areas of the body, then there'll be symptoms, there'll be other symptoms. And late stage lung cancer tends to just give this overall general sense of just not feeling well, period. And end stage symptoms of lung cancer, it can affect any area of the body. It depends on where the cancer spread. And more times than not, lung cancer cells often spread to your bones, the nervous system, the liver. And bone symptoms of end stage lung cancer can include pain in your back or your hips or frequent bone fractures. Now, if it's spread to the nervous system, there'll be frequent headaches, what else? Muscle weakness, there'll be some numbness, dizziness, lack of balance, even seizures. And now when it spreads to the liver, like liver-related end-stage lung cancer can include yellowing of your skin and eyes, abdominal pain. You experience some of these. You know, make sure you see an acupuncturist and your primary care physician. Knowing this is very important, and this is why many of you listen to Acupuncture is My Life podcast, and some of you even watch Acupuncture is My Life channel on YouTube. But if nothing else, for those that haven't, simply make acupuncture a part of your life. Because acupuncture is my life. What's yours?